Here, I am the owner of Skin Serenity Spa, and I am a Florida State licensed esthetician as well as a PCA certified skincare specialist, advanced chemical peels, microneedling, dermaplaning, cryotherapy, excuse me, lash lift. I am certified in all of those things. I have gone to school and taken classes for all of those things. Now what I'm going to show you today is some dermaplaning. And did you wash your face?
Yes.
Okay. So when a client comes in and they've washed their face, you have to understand that this is a medical treatment. This is basically a medical treatment. Not in the respect that it's a doctor treatment, but you always have to make sure that you treat the skin properly. So this is an alcohol prep, and the reason that we put a fan on is so that the smell of alcohol does not go up their nose as much as possible. So we keep it on one side so that it just keeps blowing away. And so she is having her last monthly. She's a member of the VIP membership. She is leaving the membership. She's been on it for a year. She has time constraints at this point, so this is her last treatment, and she's doing it before she goes on vacation, which is great. So as you see, even though she cleansed, we still have some debris here. So that is great that we do a prep. This is a scalpel holder, okay, the scalpel blade holder. So everything that we use here is disposable. This is soaked in sanitizing, disinfectant between every client. The blades we use are quite different than most. We do use a pointed blade. Most of the time you're going to see this rounded. We do very intricate work here. Again, we're all certified in this, so we know what we're doing. We know how to handle the blade very, very well. So a lot of times people say, oh, what if you cut somebody? Well, you know, if you cut somebody, then you're not as apt in the treatment process as you should be, okay? And as you see, I put my tools and I put them away from her body. I always have my tools nearby. Again, that's as you get very apt at this procedure. For us, we always clean up anything that we see that's out of place, meaning the brows. We trim them. We give you a nice good cleanup. We don't shape and we don't design the brow. However, if you're going to do a treatment, you need to be thorough with your treatment, and you need to make sure that you're caring for your client to the best of your ability. And this is taking me literally seconds to do anyway, but those few seconds that I'm doing go a long way with the client. Now I will take care of some of these inside, even though I'm going to be dermaplaning. And as you see, we have a very large barrier area between the client and the technician. Not to mention, this is approximately 2.5 to 3 inches thick. So I have allergies, so my allergies are out of control these days. I wear a mask, I'm toast. Okay, now that is done, and we're going to start. You always have to have a clean, dry area to wipe your blade on, and we're going to get a lot off of her. It's done in very quick, short movements. If you see somebody doing this or feel that, that is an incorrect way of dermaplaning. So they're very short, quick movements. You go over the same area anywhere from 3 to 6 times, depending upon the amount of surface dead skin cells that you're getting off. Now, around the hairline, you want to be careful of cutting back any of these fine little hairs that are there, because the more mature the woman is, the more we need every hair on our head we can get our hands on. So you young technicians out there and you clients that are more mature that are watching this need to make sure that you're aware of that. Aware that your technician knows not to go into the hairline, and the technician should know that anyway. Of course, you're not going to be able to avoid all of the fine hairs, but do your very best. So I'm going in multiple directions because there's skin that needs to get off. And so I'm just watching the way the blade is moving against the skin, all at the same time. The skin is very taut, as you see, so I've done this section here. Now I'm going to come back. So again, very short, quick, sound, confident strokes is what you want to feel from your technician. If you're a model, you're not going to feel that because you are being a model for a technician to learn. And as you see, she's got a lot of stuff coming off here. So this right here has been the bane of my existence with her. And if you see this, you don't have to get nervous because that's just surface skin. It's not a big deal because you will see at the end what she looks like. Now this here, we're going to get that flat. So never concern yourself when you see just short little bursts of blood like that. It's not a problem, and you will see it when we're done. A lot of times technicians will get a little nervous when they see stuff like that, but there's a reason. Now you need to spread out. This is a scar. You need to make sure you spread that scar out, and you need to get through that because that's what you're doing. You're planing those two ridges that are raised, and you're always wiping your blade on whatever you have right next to you. Yeah, she's got a lot coming off of her here. She always does. I'm the same as her. There's always a lot of surface dead skin cells that come off of me. Always. And a lot of people say, well, does it depend upon your age and this and that? To a certain degree, yes. But for the most part, not so much. It just depends. We have clients that are in their 30s that shed like a snake, no matter what. And they're all on proper skincare at home, meaning a retinol, a vitamin C. Now this area, we got nice and soft now. And again, don't worry when you see a little bit of blood pool. You have to understand your Fitzpatrick's. You have to understand what skin conditions they have. You have to be very knowledgeable about all of these things before you start doing these treatments. If you're not, you're doing the client a disservice. I've had this client, oh God, Ann,
Forever.
9 years. Have you been with me since I opened, right?
Yeah.
Yeah, 9 years. We're celebrating 9 years the end of October. Can you believe it?
It's amazing.
I know, right? I'm so thrilled. As you see, I'm really stretching that skin. I do slow down around the eyes, obviously. Now, this client suffers from eczema, and you can see it's a little bit active, but this is going to help with that. This helps with rosacea. This helps with increasing cell turnover on a regular basis. So I'm pulling, but I'm not hurting her, and I'm watching these fingers over here so I'm not occluding her windpipe. Again, we have sharp-tipped scalpel blades. We use a number 10. And we don't use the soft rounded ones because we are all very apt in our technique. Not to say that we haven't nicked somebody here and there. I mean, nicking is basically part of the process, especially when you're new. I've been doing this for years, and I still, every now and then, I'll nick someone. Very, very small, very subtle, and you just let the client know when you're done, you know, look at this area, look at that area. So she's cringing a little bit because I'm getting at this, all of this caked skin here. Now that looks good, much better. A lot of places that you go to do not do the ears. A lot of places that you go to, because they don't know how. A lot of places that you go to will not do the bridge of the nose. They will not do the eyelids. They will not do the nasal folds. A lot of places that you go to around town, they don't know how to do neck and décolleté. They don't know, sadly, because this treatment has become inundated with people doing this without real solid education. And I mean real solid education, not just watching a YouTube video. Again, short, quick. Solid, confident movement. Now, when it comes to around the eyes, on certain Fitzpatricks, especially 1s and 2s, you might see a little blood pooling. And remember, and if you don't remember, or those of you that are watching, if you don't know, those with lighter skin, you can be more aggressive in every treatment that you do, basically, because their scarring is minimal at best. They barely scar. The darker the bloodline, the more conscious you have to be of what treatment that you do on them because of the high chance of scarring. Peels, laser, IPL, so forth and so on. You just have to be conscious of all of that. It's got a little bit of alcohol in it, honey. I know. So this, if you can see, is pulling the surface of the blackheads, which are called open comedones. It's just pulling the surface of those off, and a lot of times the debris will just pop right out, the bacteria. Now the lip, again, we use a pointed blade, so we are very conscious of where that blade is at all times, especially when it comes to around this area when we're going like this. So again, it's all in skill and knowledge of how to dermaplane properly. And these open comedones are getting cracked open quite nicely. So now here, remember, you have the windpipe area, so you're just going to pull the skin down, avoiding that area from occluding again. Short, quick. And now I'm going to pull this way because you always want to make sure that your technician has gone an inch below the jawline, so that infamous line of demarcation. And that holds true with dermaplane, peels, microneedling, all of the above. You want to make sure that you're feeling that line of demarcation getting hit. So when you see me touch anything that's bloodborne, what we use here to clean is called Cava wipes. Now, those are, if you're in the hospital, in an ER or whatnot, you're gonna see this bucket that's usually attached to the wall, and it's like a pull-up wipe, and it is HIV, it is tuberculosis, it is hepatitis. It kills everything on contact as long as you don't wipe it dry. So when we're done, we clean everything in the room. We wipe everything down, the mag light, the surfaces, everything gets wiped down, and we let it air dry, and that's the process of killing whatever potential issues may be. So I've done forehead, I've done this half of the face. Let's come back, and you're gonna feel some resistance on this blade, you know, and don't worry about that resistance, because what's happening, and it depends upon who the person is, what's happening to me right now is I'm feeling resistance, but I know what it is. It's the open comedones that are getting cracked open. So this is a little thing that I've started doing when I first was certified in this, and no one ever showed me this. I just kind of figured this out on my own, because I always wanted to get that area that's neglected. And don't be afraid of turning your client's head around. The client's head needs to be loose. You need to tell them that when they first get down on your treatment table. So there's a verbal communication between you and the client, and it goes like this. I need your head to be very, very loose. I need to be able to turn it side to side. There's no talking after I'm done with the forehead. And then the last but very, very crucial part is, if you get an itch, you need to motion so that I can move the scalpel away from your face. I can't tell you how many times clients have forgotten that and come very, very close to having a pretty bad cut on a finger. So you need to be very adamant. So those three things: head needs to be loose so you can turn it side to side. You can talk until I'm done with the forehead. Once I'm done with the forehead, there's no talking. And then please motion somehow so that I know that you have an itch somewhere. Now, as I'm doing this, my eyes are on the prize. My eyes are on her face. However, you need to have a third eye vision. You need to understand. So right now I can see over here. Yes. Huh?
Are you videoing?
I am.
Okay. I'm about to do Amy. I don't know.
Oh, yeah, go ahead. Go in with her, please. Yeah, for sure. That's crucial. Yeah, for sure. And then my vision is over here. I can see all of this. I can see over here, even though I'm looking straight down. So you have to have that keen sense of knowing everything. I saw her body English when I went over that comedone on her forehead. I saw her not just on her face, but I saw her body. I watched it. So you have to be very, very aware. Again, that comes with time and experience of the technician that's doing you, or the technician that you've instilled your faith and confidence in to perform this treatment, which is not a fly-by-night treatment, and it should not be treated as such. We do here at Skin Serenity Spa, our technicians, it's myself and 3 others, we do approximately 100 dermaplanes a week. And that's mainly because our clients, first of all, understand the value of a good solid dermaplane, but it's part of our membership program. And we did that so that it was affordable for our clients to come in here every month for one of the 3 amazing treatments that are part of that program. And this happens to be one of them. And this has been one of the, other than microneedling, it is one of the top treatments that we do here at Skin Serenity Spa. You can add this with a facial. You can add a treatment mask to this. You can add a peel with this. With that being said, you better make sure, again, that your technician knows exactly what they're doing, because that is now an advanced, this is an advanced treatment as well, but now you've just taken that treatment to a whole nother level. And again, we do dermaplane with peels all the time. All the time. Mary Weeks, our technician, our other my senior lead technician, actually, she's in doing a dermaplane with a peel right now. So again, an inch below the neckline, short, quick. So what I'm doing is I'm moving around the face. I'm looking at everything. I'm looking at where I possibly missed. I'm looking at where there might be a little bit of extra skin. Because remember, this, for us technicians, this is about skin removal. This is not about hair removal. This is about skin removal. The hair is just an added little cherry on the cake. Under the eyes, I'm pulling down. As you see, remember, I have a point here. Again, very apt, very adept in my treatment. Now, sometimes if they've never had this before, there'll be a little quote-unquote windburned afterwards. We do thorough post-care instructions. Thorough. Post-care instructions are given to you. They're gone over with you, and they're given to you. And again, everyone here is certified in dermaplaning. So if there's ever any questions, you can always call, and Alexis, our front desk customer service, will either give a message to one of the technicians or be able to put you on the phone with someone. So as you see, I'm doing the lids. I'm just coming across. I'm very careful. I'm watching here and I'm watching here, and I'm just being careful not to cut any of the hairs up above. It's the angle. It's all in the angle. This side, I go at it differently because I'm right-handed. Again, I know exactly where my blade is at. Front, back, center. I know where my entire blade sits. So I'm hitting all of that hair there. Now, there is, normally we don't do a lot of extractions post with the dermaplane. However, she's going on vacation. She needs some of this removed for sure. Again, conscious of where that blade is. I know exactly where it is. And the reason I haven't disposed of it yet is just in case I need it. We do not use comedone extractors here. They are a very dangerous little tool. And if you've seen video with people using comedone extractors, you will see a large indentation. So as you see, I'm extracting, and we're not leaving any quote-unquote pot marks from where the extraction's taking place. So another thing to be conscious of as a consumer, you want to be very clear about how they're performing their extractions. We are very good at performing these extractions in this manner. This is much less painful, even though there is, especially in the nose area. And breaking all of that surface has made all of this just come right out so much easier without any effort, with the exception of this one right there, which now pressure, okay, and pressure again, and there it is. So again, I'm not doing a million extractions, I'm just cleaning some stuff up that really is screaming at me. Now that ended up being a little bit blight, but it was a huge open comedone that I just cracked open when I was dermaplaning her, and I knew to go back at it, and this one was as well. And I just knew to go back there. Again, experience, education, proper education. How's that? Proper education. Eczema's acting up just in the corners, and I'm gonna put some. I'm gonna hit that with some sunscreen. It'll help loosen it up, and then I'll put a little bit of moisturizer inside your ear. Okay.
Oh, great.
So now I'm covering that debris up, so I'm not gonna go near it. I'm gonna address some things. Again, your esthetician, your technician needs to pay attention to what's going on with you. So I'm just using a little bit of rebalance. We are PCA, we are a PCA authorized dealer, and we are also #1 in the Southeast Florida region. We're also in the top 3% in the world with PCA skin. So I am just hitting this to give her a little bit of relief. The other side looks good. This is always her tough side anyway, always, since I've known her. I'm just gonna hit a little bit there. Now I'm using weightless SPF 45 because she has a tendency to have open comedones, nose, forehead, and bilateral cheek area. Some on her chin, but not as much as other areas. You have to be very thorough when it comes to your SPF. You're going to go through the brows and get it on here. You want to get her covered with SPF because you just removed a lot of skin, and you need to make sure that she's completely protected when she leaves, or he. Now the one thing that we do follow up with, and I'm taking my gloves off because I'm not going to be touching her moving forward, is we follow up with a lip SPF, lips, and let me see lips. So Sun Bum is the only lip SPF out there that's a 30 that has the Skin Cancer Foundation of America seal. So every SPF that we use here carries the Skin Cancer Foundation of America seal. And there you have a full face dermaplane with minimal extractions on a Fitzpatrick 1 client. who's ready to go on vacation.